So there is a need for us all to be concentrating on patient-related outcome metrics. These are the metrics that matter to patients. SAGES is taking the initiative. We will end with these running.
All right, so what were you most nervous about the surgery?
I was most nervous about the recovery and the chance that I may have a stoma after surgery.
And what do you wish the doctor told you about that that you felt you didn't get that information from the doctor? Is there anything that you wish you would have known before the surgery?
I guess I wish I would have known that, the struggle of how things would have been when I first went home, when I only spent one night in the hospital, and then maybe the 4th or 5th days after surgery were kind of a struggle. I was really feeling pretty bad, but I bounced back after that, like next couple days.
Is there anything, information that you felt the doctor didn't provide you before the surgery?
No. Oh, you know what? I thought of one. She took my appendix out. I didn't know that was going to happen.
What were you the most worried about going into surgery with?
Okay, so I was most worried about anesthesia. Would I be able to wake up from it and really bounce back? Because anesthesia can be, touch and go. Like, it could be a couple days before it get really out your system. So I was really worried about that because I've never been under anesthesia before. I was also afraid of what would take place personally after the surgery, like especially knowing that I had a stoma now and getting back to the norm, normal things like that. People asking questions about the Crohn's, what is Crohn's. Just on a personal level, it was kind of, I was afraid of what would take place after that. But other than that, I really wasn't too afraid of the surgery because I knew I was in good hands. But the anesthesia part would be the most scary part, going into it and wondering what would happen afterwards.
What did your surgeon say, or what do you wish the surgeon would have said to you to help you through the process of having surgery?
Just give me a little bit more information in the beginning about my stoma, like what to look forward to, things that could possibly happen with the stoma, like prolapse, like in my stoma was to prolapse or retract, because I deal with both of those. I deal with a prolapsed stoma and retracted stoma. If I would know a little bit more about that, I've been, a little bit prepared when that happened. That's pretty much it. Gave me a lot of information about my stoma got a little blocked up. He had told me what it was when I was, had to go up the opposite way. She told me what was going on with that. So, I was pretty much prepared. She gave me some good information in the beginning.
Let's see. Yeah. So what do you wish you would have known before going into surgery?
I probably guess I wish I would have known how extensive the healing process could have been, because I personally had complications with my surgery. The healing probably wasn't as, standard as normal people would have. And so we had a lot of follow-ups and we had to call a bunch of people and be like, what do we do? Like, what's going on? And so it was just like, I wish the healing would have been a bit more clear. But again, because I had complications, it was different. So, yeah.
What do you wish you had known before you had gone into had your first surgery?
Yeah. Okay. Are you recording? Okay. Let's see. I guess what I wish I would have known, or like what I was most concerned about going into surgery, was complications. And I didn't really know what those were. Like, I didn't know the possibility of what any of those could be. Like, he told me, but I didn't really get the grasp of it until I had those complications. So it's like, once I got all of those, it seemed like it was kind of like, oh, I was not prepared for this at all, and it was kind of horrible. But I guess that's practically what that would be. Yeah.
I was the one thing, just that appendix thing is real. It happened to me. The lady was like, "Oh, you took my appendix out." I was like, "Yeah, that's a good thing. Don't worry about it." And he's like, "No, well, why didn't you tell me?" I'm like, "Well, it's connected." And they're like, "Well, I didn't know that." So they'll like it ahead of time. If you tell them they're going to take their appendix out.
I did learn from this video that pretty much everything I'm worried about, the patients are not worried about. And all the stuff I'm not worried about, the patients are worried about. And I have changed my way to talk about complications, because if I went into the 200-day of what could happen in every possible scenario, you'd first never leave clinic, and second, no one would ever have surgery. And so I say, these are the lists of complications. They affect everybody differently, and you are never going to be able to understand how it will affect you until it happens to you, because it's something that you can't describe how bad people feel when they have a leak, or need another surgery for ureteral injury, and again, to try to explain all that is impossible. And so I just say, just call. If you don't know after, just call us. But again, obviously, people still aren't prepared.
So much to our panel and for everyone for coming today. It was a great session, and we really appreciate it.